Hi, so I'll try my best to explain kung anong kailangan explain about NCP and yung components niya. So this is how I do my NCP and I hope it helps you. So first, syempre, ano yung NCP? Nakakodigo ako para hindi ako mawala. So isa siyang formal process na which includes correctly identifying the needs, potential needs, or risks ng patient. So, it is a means to provide communication among nurses, their patients, tapos with other healthcare workers para ma-achieve natin yung healthcare outcome na intended for yung patient. So, ayun, pag walang nursing care plan, pag ura-urada lang na interventions ang ginagawa natin without planning, pwedeng mawala sa atin yung pasyente. Or pwedeng mawalan ng tiwala sa atin yung pasyente. So, ayun. So, first, let's start with, yan, components ng nursing care plan as per sa atin sa SON. So, andyan yung assessment, which includes yung demographic data, name, age, sex, occupation, ganon, religion, kasama din doon. And then we also have the history of present illness. Kung ano yung chief complaint, tas kung paano nagsimula yung sakit niya or yung chief complaint niya. And then we also have yung past medical or surgical history. So, kasama niya dito yung kung nagkaroon ba siya ng surgery noon, nagkasakit ba siya noon na may be related or not sa present na sakit niya ngayon, mga ganong bagay. And then we have family history. Ito yung kung may diabetes ba si mother side, may hypertension, either or, pwede din namang sa lolo-lola, ganon. Social history, so ito yung history niya sa pagkikipaghalubilo. So, sino-sinong tao na kasama niya, anong lifestyle niya, ganon. So, kasama dito yung environmental history. So, gaano kalapit yung bahay niya sa road, may construction ba sa surrounding, ito ba ay isang place na breeding site for mosquitoes, ganon. And we also have the OB-GYN history. Most likely, mostly ito para sa babae, ito sa girl client natin nakukuha. Ayan. So, after that, we also have the pathophysiology. So, dito mo ina-explain yung sakit ng pasyente, especially pag given yung medical diagnosis niya. And then, you relate that. So, ang pathophysiology natin, hindi lang yung process kung how the disease works, but kasama din dyan, after mo ma-determine kung paano yung disease and how it works, determine mo din dyan yung nursing diagnosis mo. After that, ilalagay mo din ang nursing interventions mo doon. Or that is if yun ang require ng inyong instructor. So, I'll be showing examples of how it is done then. And then after that, kasama sa pathophysiology is actually scientific explanation ng given na focus mo, yung given na priority diagnosis mo already. Dapat ganun siya. And then we have the nursing diagnosis after the pathophysiology. So, and then yung prioritization mo. This depends lang sa CI mo kung yung iisa lang ba yung pinaka-priority mo ang ilalagay mo or minsan tatlo. So, rationalize mo kung bakit yun yung first, yun yung second na diagnosis mo. So, ma-rationalize dyan. Yun doon yung scientific explanation. And then, the fourth component is yung NCP proper. Dito na yung table. So, yung table mo is composed of 1, 2, 3, 4, 5, 6. Most likely 6 na columns. So, yung first is yung assessment mo. Andito yung subjective and objective data mo. Sa subjective and objective data, make sure na yung data nilalagay mo dun is focus sa kung ano yung nursing diagnosis mo. Huwag mong ilalagay ang data na irrelevant naman. Hindi naman siya part ng nursing diagnosis mo, no? Kunwari, ang nursing diagnosis mo is on ineffective airway clearance. Naglagay ka ng isang assessment finding na hindi naman related sa respiratory tract, mga ganun. So, you have to research din, read on yung vital signs and other signs and symptoms na related sa respiratory tract, kumbaga, or respiratory condition, no? And then, next is yung nursing diagnosis mo. Ayan. Minsan dito din nilalagay yung scientific explanation kung bakit and ang nursing diagnosis mo. And then, don't forget to put your references doon sa my scientific explanation. And then, after that is your expected outcomes, which is yung LTO, yung long-term objective, and your STO, which is your short-term objective. Yung LTO, sabi nila more than 3 days. Yun yung objectives mo. And STO is, this is the objectives or goals you could accomplish in within 24 hours hanggang 3 araw. From what I remember, correct me if I'm wrong. And then, after that is your intervention. So, dalawang category siya kung paano siya pwedeng i-divide. Pero depende na naman yan sa instructor kung alin ang gusto niya. So, interventions, pwede siyang ma-divide into diagnostic, therapeutic, and educative. Ayan. So, diagnostic, most likely dito yung assessment. Findings mo, parang assessment. Anong gagawin mo sa assessment. So, yung mga terms ito is monitored, noted, assessed, mga ganon, reviewed. And then, next is your therapeutic. So, ito na yung gagawin mo for the patient. Kunwari, elevated yung headrest niya, did tepid sponge bath, ganon. And then, educative, ito yung, syempre, yung matuturo ka. So, instructed, emphasized, mga ganong terms. And then, there's a second category kung paano mo siya i-divide. It's independent, dependent, and collaborative interventions. Sa independent, ito yung pwede mong gawin na hindi ka kailangan utusan ng doktor or hindi kailangan ng doctor's order. Dependent, ito kailangan with doctor's order. So, hindi mo pwedeng gawin yung intervention unless in order ni doctor. And collaborative is, ito yung you can do both with the doctor or other health workers na intervention. So, after the interventions is yung next column is the rationale, which you will explain kung bakit yun ang intervention mo for this specific nursing diagnosis. So, make sure no yung interventions mo then is relevant to the condition of the patient and the nursing diagnosis na binigay mo. So, you have to really read and screen out. Pag hindi naman siya proper or appropriate for the condition of the patient, mo siyang ilalagay. And then, evaluate. So, dito, depende na naman sa instructor. If yung evaluate is you're going to make a criteria of how you will evaluate yung outcomes na binigay mo sa LTO and STO. So, ayun yung fully met, partially met, and not met. So, magbigay ka ng criteria kung paano masasabi na fully met, paano masasabi na partially met, and paano masasabi na hindi na-meet yung goals. Or, minsan, pag sasabihin ng instructor na assume na tapos mo na, nagawa mo na lahat nung nasa nursing care plan mo. Sa evaluate part, nilalagay mo dun ng kunwari na LTO has been partially met kasi ganito, ganyan. So, you explain kung bakit partially met. So, that's the 2 ways you're going to do sa evaluate. So, that is the whole nursing care plan. I hope I was able to explain how, or at least a glimpse or a gist of what happens or what is done sa components na yun. So, and lastly, don't forget to put your references, no? APA format din. I'll try to send you the APA format or kung sinensend nyo, you have to check it. Kasi minsan 1 point lang naman siya, references. Pero, every point counts din sa ating NCP. So, ayun, that's for the NCP. So, next would be 8 tips for you. And since nahihirapan kayo sa nursing diagnosis, how I formulate my nursing diagnosis. So, next video tayo.